The handle of the forceps are held differentially depending on the position of the tooth to be removed. Maxillary forceps are held with the palm to the side or underneath the forceps so that the beak is directed in a superior direction. The forceps used for removal of mandibular teeth are held with the palm on the top of the forceps so that the beak is pointed down toward teeth. The handles of the forceps are usually straight, but some may be curved to provide the operator with a better fit. 741 هذا أحيانا يعني يفضلوها بعض الجراحين. The hinge of the forceps, like the shank of the elevator, is merely a mechanism for connecting the handle to the beak. The hinge transfers and concentrates the force applied to the handles to the beak. One distinct difference in style does exist. The usual American type of forceps has a hinge in a horizontal direction and is used as has been described. The English preference is for a vertical hinge and a corresponding vertically positioned handle. 742 ذني أول الإنجليش والأمريكان 38 هذا الأمريكان. Thus, the English style handle and hinge are used with the hand held in a vertical direction as opposed to a horizontal direction. The beaks of the extraction forceps are the source of the greatest variation among forceps. من إن البيكس. The beaks are يعني الأسنان مالته. The beaks are designed to adapt to the tooth root near the junction of the crown and root. It must be remembered that the beaks of the forceps are designed to be adapted to the root structure of the tooth and not to the crown of the tooth. مو نلزم بيها the crown. Okay, in a sense, then different beaks are designed for single rooted teeth, two rooted teeth, and three rooted teeth. The design variation is such that the tips of the beaks will adapt closely to the various root formations, improving the surgeon's control of forces on the root and decreasing the chances of a root fracture. The more closely the beaks of the forceps adapt to the tooth roots, the more efficient is the extraction and the lower is the chance for undesired outcome. The final design variation is in the width of the beak. Some forceps beaks are narrow because their primary use is to remove narrow teeth such as incisors' teeth. Other forceps beaks are broader because the teeth they are designed to remove are substantially wired. For example, lower molar teeth forceps designed to remove a lower incisor can theoretically be used to remove the lower molar. Okay, but the beaks are so narrow that they will be inefficient for that application. Similarly, the broader molar forceps will not adapt to the narrow space occupied by the lower incisor. Therefore, it cannot be used in that situation without damage to adjacent teeth. The beaks of forceps are angled such that they can be placed parallel to the long axis. ماكو angle لا parallel of the tooth with the handle in a comfortable position. لازمها براحتك. Therefore, the beaks of maxillary forceps are usually parallel to the handles. Maxillary molar forceps are offset in a bayonet fashion to allow the operator to reach the posterior aspect of the mouth comfortably and yet keep the beak parallel to the long axis of the tooth. The beaks of mandibular forceps are usually set perpendicular to the handle, which allows the surgeon to reach lower teeth and maintain a comfortable controlled position. Maxillary forceps. The removable above maxillary teeth requires the use of instruments designed for single-rooted teeth and for teeth with 3 roots. Maxillary incisor, canine teeth, and premolar teeth are considered single-rooted teeth. The maxillary first premolar frequently has bifurcated root, but because this occurs in the apical third, it has no influence on the design of the forceps. Okay, the maxillary molars have trifurcation roots, so there are extraction forceps that will adapt to that configuration. After proper elevation, single-rooted maxillary teeth are usually removed with maxillary universal forceps, usually number 150 الفقر 43 هذني. اوكي وهذا 150 هاي اليونيفرسال. The number 150 forceps are slightly S-shaped. S-shaped when viewed from the side and are essentially straight when viewed from above. The beaks of the forceps curve to meet only at the tip. The slight curve of number 150 forceps allow the operator to comfortably reach not only incisor but also premolars. The beak of the number 150 forceps comes in a style that has been modified slightly to form the number 150A. Number 150A forceps are useful for extraction maxillary premolar teeth and should not be used for extracting incisor because of its poor adaptation to the root of incisor. Then number 45 ذني. اوكي خمسة وأربعين وأربعة وأربعين هاي هابرال بيكس وفورسبس البريمولارات ممنوع نستعملهن للسنترالات. In addition to number 150 forceps, straight forceps are also available. Number 1 forceps, which can be used for maxillary incisor and canines, are easier to use compared with the number 150 forceps for upper incisors. Maxillary molar teeth are 3-rooted teeth, which with a single bilateral root and apical bifurcation. Therefore, forceps that are specifically adapted to fit maxillary molars must have a smooth concave surface for the bilateral root and a beak with a pointed design that will fit into the apical bifurcation. This requires that the molar forceps come in pairs, left to right. In addition, the maxillary molar forceps should be offset so that the surgeon can reach the posterior aspect of the mouth and remain in the correct position. The most commonly used molar forceps are the number 53 right and left forceps. في الفيجر 46 إذن 46 نستعملهن maxillary molars. These forceps are designed to fit anatomically around the palatal beak, and the pointed buccal beak fits into the buccal bifurcation. The beak is offset to allow a good surgeon position. A design variation is shown in the numbered right and left forceps, which have a longer, more accurate pointed beak formation. They are particularly useful for maxillary molars with the crown that are severely carious. من 47 47 ذني اللي كلش كاريوس 47 46 العاديات. The sharply pointed beak may reach deeper into the trifurcation to sound dentine. The major disadvantage is that they crush crustal alveolar bone, and when used in intact teeth without due caution and proper elevation, they can fracture large amounts of buccal alveolar bone. On occasion, maxillary second molar and erupted third molar have a single conical root. In this situation, forceps with a broad, smooth beak that are offset from the handle can be useful. The number 250 forceps exemplifies this design. 48 ذني إذا الروت مفرد. Another design variation is shown in the offset molar forceps with a very narrow beak. These forceps are used primarily to remove broken maxillary molars but can be used for the removal of narrow premolars and for lower incisors. These forceps, the number 65, are also known as root tip forceps. من 49 ذني نستعملهن للبروكن روت. اوكي نستعملهن نارو بريمولار واللور انسايزر وبروكن مولار. Broken maxillary molar root, but can be used for narrow premolars. A smaller version of number 150 forceps, the number 150 is forceps useful for removing primary teeth. 57 ذني primary teeth. These forceps adapt well to all maxillary primary teeth and can be used as universal primary teeth forceps. Mandibular forceps. Extraction of mandibular teeth requires forceps that can be used for single-rooted teeth for the incisor canine and the premolar, as well as for two-rooted teeth for the molar. The forceps most commonly used for the single-rooted teeth are the lower universal forceps or the number 151. These forceps have handles similar to shape to number 150 forceps, but the beaks are pointed inferiorly. For lower teeth, the beaks are smooth and narrow and meet only at the tip. This allows the beak to fit near the cervical line of the tooth to grasp the root. Okay. The number 151 A. Forceps have been modified slightly for mandibular premolar teeth. These forceps should not be used for other lower teeth because their form prevent adaptation to the roots of teeth. The English style of vertical hinge forceps can be used for single-rooted teeth in the mandible. Great force can be generated with these forceps unless great care is increased. The incidence of root fracture is higher with this instrument من الانجليش ستايل 53. لأني خطراتي سبب منه كسر. اوكي then universal يمكن لو then yes I think adapt to lower premolar teeth. Fracture higher with this system. Mandibular and molar are bifurcated, two-rooted teeth that allow the use of forceps that anatomically adapt to the tooth. Because the bifurcation is on the buccal and the lingual sides, only single molar forceps are necessary for both sides. يعني ما يحتاجون يمين ويسار. In contradistinction to the maxilla, in construction to the maxilla for which a right and left pair molar forceps set is required. Useful lower molar forceps are the number 17 forceps. These forceps are usually straight-handled and the beaks are set obliquely downward. The beaks have pointed tips in the center to be set into the bifurcation of lower molar teeth. The remainder of the beak adapts well to the sides of the bifurcation. Because of the pointed tips, the number 17 forceps cannot be used for molar teeth, which have fused conical root. For this forceps, for this number 151 forceps are used. A major design variation in lower molar forceps is the number 57, the so-called cowhorn forceps. هاي يعني مشهورة كلش 55. cowhorn قرن البقرة. These instruments are designed with two pointed heavy beaks that enter the bifurcation of lower molars after the forceps يعني تدخل جوا bifurcation. After the forceps are seated in the correct position, usually while gently moving the handle up and down يعني لفوق ولجوا, the tooth